This is the treatment plan for a lower tooth number 19 mandibular case, single unit implant. This patient was scanned and a partial scan was sent. It is not recommended that we send a partial scan simply because it's very difficult to merge the data. Then you'd have to go in and merge the data manually in order to set the load vector analysis and the placement of the implant in the right position. Anyway, the technicians went ahead and made sure they merged the data manually. Of course, that takes quite a bit longer and it's very, very time consuming. So in this section called the surface scan, we went ahead and digitized and converted the impression into a digital impression, and then we will proceed and render the negative into a positive so that we can get a good topography of the actual arch that we are planning to do the implant on. And this will be used, this data of the surface scan of the impression will be used to be merged with the DICOM data of the patient in order to fabricate a surgical guide that will fit in the end. So in preparation for merging the surface scan of the impression and the DICOM scan of the patient, we go ahead and merge the bite so we can analyze the load vector based on the occlusion of the patient. And from here, basically, we went ahead and merged the data, and we merged the bite with the lower arch. And the second step will be to superimpose this surface scan with the patient DICOM data. In superimpose here, as you can see, this is the patient scan and this is the impression scan. We went ahead and merged the two together, and this is the merge right here on the bottom. As you can see, it's very difficult to merge the data when you have only a partial scan for the patient, but it can be done manually, but again, it's very time consuming. And here, once it's merged, we can actually get it together so we can actually start calculating the load vector with the opposing arch. Here we went ahead and labeled the teeth so we can later on further segment the teeth, the root, and the tissue, and then this way we can have a complete view of the bone, of the roots, of the tissue, and of the teeth. So now we went ahead and segmented teeth number 18 and 20, and then the next thing we're going to do is we're going to segment the roots and reverse engineer the tooth. Then we went ahead and added a tooth by mirror imaging tooth number 30 into tooth number 19 position right here. If I double click on it, it'll start calculating the load vector there for us. And then if I remove the tissue, we should be able to look at the adjacent teeth and see exactly what's going on with. So rotating it and looking at it from the side, we could see the load vector that's a parallel to the roots of the adjacent teeth, and the access hole is going to be right in the center of that tooth that we just reverse engineered. Now we'll go to implant planning and place the implant. Now in implant planning, we double click on the tooth and then we will select a 4.3 by 11.5 millimeter implant in here. Notice the safety zone that's all the way around right here. Notice the load vector is right in the center of the tooth there, and we're well aware of the position of the nerve and the triangle where it's green here to show us where the nerve is to stay away from it. So again, here we could look at the bone. That's the mental nerve, and then that's the nerve underneath it. We can remove the tissue, and then also we can actually remove the roots of the adjacent teeth if we want to. We can remove the tooth that we designed in here back and forth, and then finally we can place the surgical guide and look at it. And this is the surgical guide. I'm going to remove the bone, and I'm going to remove the volume view, and if I remove the teeth that we selected, this is where that implant is going to go through the surgical guide that was designed for this. So we will give you a universal sleeve with the universal drill kit so that you can actually place that Straumann implant in here. So our proprietary software in the end will take your design and animate it, and this is a very powerful presentation tool for marketing your case and presenting it to your patient. So now this is the animation process that occurs, and this is what we call animate and present. So you can close the case. We can select various chapters for presentation and include it for you in the actual treatment plan that we will put on demand in the iView in the cloud. So I will show you this in the final iView so you can review the whole thing. Here it's showing the bone, that was added, and we have a 360-degree view of a spinner slice around to show where the implant is relevant to the mesial distal buccolingual position of the bone in the mandible.